Hi everyone, so we're going to do a brief overview of phlebotomy here at Rockingham VNA and Hospice. So firstly, when you get a lab visit assigned to you, you're going to be looking at your orders. You want to see exactly what you're supposed to be drawing, which physician you're supposed to be reporting those results to, their fax number, any diagnosis codes to use on the form. That might all be within the order. I will say too, when looking at the specific tests, you want to look at what tubes you're going to need. All that information is in the working binder under lab information. So if you're not sure of what tubes, go with which tests. Some of them are very specific. You can always call Exeter Hospital Lab, the inpatient lab. They have been really good in the past and will direct you as to what color tubes to be using. You're going to want to be filling out your Exeter Hospital form. So for the sake of the education today, we're just going to look at Exeter Hospital, but of course, as you guys know, you can go to Portsmouth Hospital, Parkland and Derry. Those have their own designated forms. You can get those at the office. You can let the runners know that they need those, if you need those. So I know you guys are familiar with this. Always remember though to put your initial at the top of the form to indicate that you are drawing. That initial will also be on your specimen once you've drawn it. Make sure here when you're indicating which physician you want the results to go to that you are writing the first and last name. That is the responsible party. Any diagnoses, this is the code, the numbers and letters, not actually writing the diagnosis. The fax number of the physician that you want these to go to. You're going to be filling out here what tests you need. Your start of care date is on your main profile screen. You're filling out the patient demographic information. For primary insurance, you're going to do the patient name, their date of birth, what their insurance is, Medicare or private insurance, and what the policy number, it's usually that HIC number on the profile screen. Also remember that we want those results to be faxed to us as well to have in the patient's chart. So you're going to indicate to please fax results to our VNA and hospice. Also, sometimes orders indicate to have results faxed to two or more than one physician, depending on who's involved in their care. So do pay attention to that in the orders, and you would indicate that down here too. Another thing, of course, is always making sure the patient is consenting to this, and that's what this bottom part is. That they are dating, time, print their name, and that they are signing, and they will be signing before you draw the blood. So I have my order, I have my lab slip, I know which tubes I want and I need for the draw. I can always look in the working binder. There's all sorts of forms like this as well. One important thing to keep in mind too is the order of draw. These tubes have preservatives, and you do not want to be mixing things from one tube into another that can affect the results. So this is an example of the lab order of draw. Again, this is all found in the working binder. All right, we're going to talk about some of our supplies. So we're going to be using straight needles. That's really what you want to be using first. That is the standard going in the AC. We have two different types of straight needles, a 21 gauge and a 22 gauge. So I will just show you guys the way these put together in case you're not very familiar with these. Just think of clear to clear. I'm going to twist this off. Keep in mind too that this is also a needle. So you see that there. So this is considered a sharps even at this level. And the way that works is that when you get your tube using the vacutainer, which I'll show in a minute, the sleeve pulls back, and that's how it allows the blood to enter the tube. So just keep that in mind. So now I'm going to connect my vacutainer, and this is how you would put it together. This is your safety, and this is how you would assemble that equipment. All right. So I'm going to the patient's house. Well, hi Rachel, how are you doing today?
I'm good, thank you.
Thanks. So I'm here to draw some blood, and for your doctor. Is that okay?
Yes.
Okay. I'm gonna have you sign right here. Great, thank you. Now, is there an arm that's usually better for you?
My left.
Your left arm? Okay. Yeah, I can see that you've got some good veins there on that side compared to your other side. Have you been drinking plenty of fluids like I told you when I called you this morning?
Thank you for the reminder.
Okay. Very good. The other things you can do if they don't have good access is put a hot pack, a warm cloth, warm washcloth. If you don't feel anything good, let it sit there for a little bit. Also having them dangle their arm just to help with that blood pooling by gravity. That kind of helps to vasodilate and open up the veins and maybe see something there. All right, so I'm gonna wash my hands first. I'm bringing in my supplies using my lab bag. Also as a reminder, when you're carrying specimens to and from patient home and to the lab, to the hospital, always be transporting that in a lab bag. That is protocol. All right, let's see what you got. So I'm gonna start by just checking her veins, although I know right here is where we're gonna go. I'm gonna gather my supplies. And I'm going to be doing a 22 straight needle today. One thing I also encourage is you can bring an apron to put under your bag. You never know what's in patients' houses, so for infection control purposes, aprons are also very good for your lab bag in addition to your clinical bag. Always make sure your patient is sitting comfortably, not on a stool or on anything that in case she passes out, she would then fall on the floor. Have you ever had complications or passed out when giving blood? No. No, okay. I'm gonna apply my tourniquet. Never apply it for more than a minute. You're going to be cleaning the site. Now some people have a lot of like very thin skin or rolling veins. So when you're drawing, you're really going to want to make sure that with your other hand, you're pulling back to taunt the skin to kind of stabilize the vein. I'm going to get my straight needle ready. With the bevel up. These are my tubes I'm drawing today. I've looked at my order of draw. All right. There we go. Okay, so I'm in. I'm going to stabilize my right hand. I'm not moving it because I'm in the vein. I'm getting my blood. You can relax your arm there, Rachel. You don't need to. Some people like to have a fist. That's not necessary. So I let the tube gather their blood. I got to rotate it the number that it indicates on our forms in the working binder. So I'm keeping my right hand nice and stable. The needle's in. I'm moving around more with my left hand. All right. I'm releasing here. Okay, and then with the safety, I'm going to use the table to execute the safety. We're not using that on the patient, obviously. I'm going to apply pressure. Are you on any blood thinners or anticoagulants?
No.
Okay. You want to be the one putting the pressure. Ultimately, you're responsible for the site. I would say at least 30 seconds to a minute. I'm going to have a look. Any bleeding, any hematoma, bruising forming, site looks good. Okay. You can put tape or like a little band-aid is fine. The other thing you're going to do before you leave the home is label your specimens in front of the patient. You're going to be labeling 5 things: the patient's name, date of birth, the date, the time, and your initials. And you're going to be doing that at the patient's home. All right, so I'm going to be writing it on here. And can you confirm to me your name and date of birth again, please?
Rachel B.
Mm-hmm.
5574.
Okay. All right. And you have, per our protocol, you have 1 hour to bring the lab specimens to the hospital or the lab. One thing to also keep in mind, sometimes that we see is fasting labs. Things like lipids and cholesterol levels are fasting labs. It doesn't always say on the order, but they are. So before you go off and draw lipids at 3 in the afternoon, really double check with the physician that he does or she wants them, especially true fasting labs. And you might need to have some more planning ahead of time the night before if those truly need to be fasting. Also in your documentation, once you're all done and have transported the tubes to the lab, you're going to indicate which labs you drew, how the patient tolerated it, what site, with what needle size, first or second attempt. We are allowed only up to 2 attempts. If you don't get it on the second try, do contact scheduling. It can either be done later that day, or if it can be the next day, that's fine. And again, like how it was tolerated by the patient. And all of that information is in the working binder. So if there's any questions, you can always reach out to me or Tani. Do you have any other questions today, Rachel?
No, thank you.
Very good. All right. Thank you, everyone.